All right, hello everyone. Welcome to our second DD Network Virtual Town Hall. We have a panel of speakers that will be joining us today to discuss some of your issues. We had some questions submitted by the community, and we'll be getting to those as well. So hopefully, if you put a question in, we will get to it. Our panel members have those questions at their fingertips ready to go. And that is me. I will act as our facilitator today. My name is Mike Murata, and I am the director of the Richard West Assistive Technology Advocacy Center, which is housed at Disability Rights New Jersey. I will be managing the chat window for us and also the muting and unmuting of people. So if you have a technical issue as we go through with Zoom, please feel free to leave me a comment in the chat. You can do that and send it directly to me privately. You can pull me down from the list there, and you can send a message directly to me, and hopefully I can help you out. Just some other quick housekeeping before we start. We are recording this session, so we will be able to have this available to you later on. We will also collect the chat window, so we have that information as we go further, and then we'll work to add some of the questions we don't get to today. We will make sure to add them to kind of an ongoing questions and answers document that we've been gathering up. So I'm glad you're all here. Thanks for taking some time out of your Saturday for this. And for the introductions of the panel, I will turn it over to Gwen, and she can introduce everyone who's here today.
Great, thank you, Mike. This is Gwen Earl. I am the Executive Director of Disability Rights New Jersey. And the first thing I want to make sure is that, Mike, can you let me know if you're hearing me?
I hear you.
Excellent. I will let everybody know that I am having some technological challenges on my side. My internet must be really slow, so I can't really see necessarily what you're all seeing. So I will do my best to do a brief introduction. So Mike, can you switch to the slide that has the pictures of folks from DRNJ?
Sure.
So our panel members today include staff from Disability Rights New Jersey. And here we have our community integration team leaders of Jill Hogel and Michael Brower. And then the next slide, please, Mike. So we also have the New Jersey Council on Developmental Disabilities, and the Executive Director, Mercedes, is here. And the next slide, please, Mike, for the Boggs Center. We have Deborah Svitelnik. And our next slide, and I really apologize right now, I'm not seeing any of the slides everybody else is seeing. It's a little bit disconcerting, so I'm sorry. Our next slide is the Office of the Ombudsman for individuals with intellectual or developmental disabilities. And we have Christine and Paul Aronson. So thank you to the panel members. Last, in our first virtual meeting, we gave a little overview of each of our organizations, and those slides are at the end of this presentation if you weren't with us last time. And we also have a recording of the first virtual town hall. I'm really honored, we're honored today and thrilled that Jonathan Seafried from the Division of Developmental Disabilities, the Assistant Commissioner and Director, is able to join us today. On a Saturday, we really appreciate his time and his expertise. And I'm going to turn it over to him and ask Mike that you advance the slide to his first slide.
Good afternoon, everyone. Thank you, Gwen, for the introduction, and thank you to the panel for including the division in this week's town hall that you're having. Greatly appreciative to be a part of this. We recognize that these are unprecedented times. I've been using that word a lot since late February, early March, and it's still true every time I say it. The one thing that I wanted to start with was just thanking everyone, in the community for, just coming together and working through. We have a lot of heroes right now that are doing work. The least of which are, the direct support professionals. They are really going to work every day along with self-directed employees, making sure that individuals get the care that they need. They are, leaving their homes, going out into the community, and really just doing their very best in this trying time. And really, it's nothing but respect for the direct service professionals and self-directed employees. That includes individuals and families as well. These are new experiences for all of us. The COVID-19 pandemic impacts all aspects of life, like not just work, but home, food shopping, everything. For a lot of families that have individuals in group homes and the like, it's probably the first time they've ever had to be away from their loved one due to the restriction on visitors, and we recognize the stress that puts on everyone. And then the providers as well, just making sure that everybody has staff coming in. If you could go to the next slide for me, Mike, I would appreciate it. Thank you. One resource that I did want to make sure to mention today is on your screen right now. We recognize that the pandemic is causing a lot of anxiety on a lot of different levels for everyone. And there is a resource, and at the end of the slides, I only have a few slides to show, there's some other resources. But this particular helpline is New Jersey Mental Health Cares. It's open from 8 a.m. to 8 p.m. Monday through Friday. And it's general counseling. If anybody needs to talk to somebody and feels that could be a helpful resource for them, we are appreciative of to offer that. If you go to the next slide. I also wanted to point out that the division, even in this pandemic, we are still open for business. We're just working remotely, as a lot of people are right now. But we are open. Our hotlines are still open. Our community services lines are still open. You can call the 800 number that's on the screen, or any of the local division offices. You'll be connected with our answering service, who will connect you with a DDD employee who will help work through whatever your challenge is. We have a email for our routine questions, but we opened a special email for specifically around COVID that's on your screen that I wanted to share. If you go to the next slide. We also are doing a lot of updates and resources for the community. We have on our Department of Human Services COVID-19 webpage, we have a dashboard that we update every Monday, and that shows the statistics of COVID-19 positive, negative cases, and unfortunately client passings, because we have experienced that. Our hearts go out to any family that has experienced sickness or a passing of an individual due to COVID. We also have our general information related to COVID. We have put out a number of documents since early March related to things, talking at least weekly, if not more. And in terms of receiving updates related to webinars and the like, we do encourage people to sign up for our DDD Communications email address. To get on our DDD News listserv. That can be done following the instructions on the screen. And then the last slide, and then I'll just do an overview, if you go to the next slide, is some additional resources. For parents and families, there's the Mom to Mom hotline. It's a wonderful service that we're happy to support, and it's mothers who have experienced loved ones with disabilities and can help provide support to other family members. For individuals and caregivers, the Boggs Center for COVID-19 resources, and then for direct support professionals, the National Alliance for Direct Support Professionals. So those are some resources. In terms of just giving a general update, we've been working constantly since the pandemic started and are continuing to give updates. In terms of personal protective equipment, after several weeks of waiting for orders to come in, the Department of Human Services was allocated a portion of personal protective equipment that we have reached out to providers of group homes and other congregate settings in the state, and are reaching out to them to provide what supply we do have. It is a modest supply. It's not going to be a month's worth, but it's what we can give. We are also working to identify those individuals in our system that utilize self-directed employees who don't reside in the household. In other words, they have self-directed employees that come into their home, to provide a small amount of PPE to them as well. We have done a lot in terms of guidance through the division. We put things out on staff screening, universal masking. We've been able to onboard over 1,400 new staff to our system since the day program closures. Increased the amount of funding that residential providers have to be able to provide them additional funding for the staffing they have to provide during the day. Provided funding levels to day programs that are closed. Provide weekly or more frequently guidance. We do a webinar every Thursday at 10:30 a.m. That give an update on COVID as it relates to the DD community, and then that weekly dashboard that I talked about. And then finally, the last thing I'll talk about is our developmental centers. We operate 5 developmental centers. We've done many of the same things that we've done in the community. We put in universal masking, staff screening, including temperature checks before every shift, ended congregate dining and programming with other cottages. We are moved to in-cottage programming to keep the individuals that live together in terms of, to help reduce, and comply with social distancing. Suspended visitors there, as we have in the community. Increased cleaning and hand washing. And we do have a frequently asked questions document that we put on the division website, the COVID website that I gave to the link to earlier, for families of individuals in centers. I could go on for a lot longer, but I don't want to monopolize the time. So I thank you guys for letting me speak for a few moments, and thank you very much.
Thank you. Thank you. So as we move into the question part of our time together today, quick little reminders. This is more housekeeping stuff, and then I will fade back into the background. If you want to participate, please, there are 2 ways to do it. You can either do it through the chat window. So if you're joining us through a computer, you can do it through the chat window. Again, search for the button along the bottom that says chat, open that up. It will pop up a box for you, and you can type in questions there. Everyone can see those questions. So the panel members will see it, and someone will jump in to provide some support and some suggestions for that. If you're joining us on the phone, I see some people are, you don't really have the chat box right now if you're calling in. So for anyone who's calling in and you'd like to participate, you can email us at questions@drnj.org, and I will do my best to monitor that as we go through the hour as well. So if you send something in while we're connected, I will see it and I will pass that question along to the panel members. So with that, I'll move us to the focus areas and let the panel members take over to give us some information about some of these focus areas.
So Mike, this is Gwen. Can you hear me?
Yes.
Great. I just am asking because I continue to have some technological challenges on my end, but if people can hear me, that's great. So I'll start by just saying a few words from the perspective of Disability Rights New Jersey's efforts around allocation of critical care resources. This has been an issue around the country, and there has been advocacy efforts, and in some states, there have been policies that have had discriminatory language on the face of the policy. And so in some states, for example, Washington and Alabama, complaints have been filed with the Federal Office of Civil Rights. And by way of example, in Alabama, OCR stepped in immediately and resolved that, and the discriminatory language was removed from the policy. Here in New Jersey, we've done advocacy around it, and we sent a letter to Governor Murphy back, I believe, on April 2nd. Maybe it was a little earlier than that, asking that any policy that the state of New Jersey developed comply with all appropriate civil rights requirements. And subsequently, dated April 11th, the Department of Health released critical care resources allocation policy that is patterned really nearly word for word over a policy that was put out by the University of Pittsburgh. And the Department of Health did have a conference call with stakeholders on Tuesday night, which we were deeply appreciative. They let us ask questions. Many of the organizations on the phone are here in this town hall today. We all asked important questions. We at Disability Rights New Jersey followed up with that with a letter that went out this week to the Commissioner of Health. She had said that they would follow up on certain questions, so we put those questions in writing and sent it to her, and hopefully we'll get a response to those questions soon. I'll also just say quickly here now before I turn over for anybody else who wants to address this, that there are some, that information that we did is on a new website that we launched yesterday, which I believe there was a slide. You don't have to go to that slide now, Mike, but it's drnj-covid.org, and that's where we're collecting all of our COVID information. And the last thing I was going to say is one of the big questions that we have that we don't have an answer to is how do we know if a hospital has adopted this policy? Because hospitals do need to adopt the policy if they so choose, and that will get them immunity under state law. And secondly, how are the hospitals going to convey the information in this very complicated policy to patients and their families? And that's a question we're hoping we'll have an answer very soon.
Thanks, Gwen. Mercedes wanted to jump in on the topic of access to hospitals for families and individuals.
Sure. Hi there, everyone. Yeah, I think that's the second bullet on the screen that you might see on our focus area since our last town hall, which is not just family members, but potentially any caregiver of individuals with disabilities who may be hospitalized at this time. And given the current hospital policies of no visitors, we have heard you. We are responding to many of your questions regarding visitation in the hospital. We had a call with the Department of Health Commissioner last week on the allocation of critical care resources, and this area was raised. Many of you have written in to NJCDD's Kyoko Koko, who is our family support coordinator, and your messages have been delivered to the governor's office via Paul Aronson, who's also on this call. So we are hearing now that there is the likelihood of a release of a guidance from the Department of Health early next week. So we will share that immediately as it is provided. And in the meantime, we would encourage you to continue writing to kyoko.koko@njcdd.org so that we can maintain an early next week release of such guidance.
Excellent, thank you.
Hi, and this is Michael Brower from Disability Rights New Jersey. I wanted to jump in just one little piece of information buried in the very long CARES Act that was recently passed at the federal level. There is some language that Congress inserted into the Medicaid Act that changed around the restrictions formerly folks who are receiving Medicaid services through a waiver, our DDD population, for example, who have direct supports, they could not be paid while that individual was in an acute care hospital. One of the changes Congress made in the CARES Act was to modify that restriction so that states, if they choose to, can authorize payment for DSPs while the individual's in an acute care hospital, as long as the supports are in the person's plan of care already, it's not duplicating something the hospital already provides, and it would assist with either the individual's transition back to the community or prevent them from losing functional ability while they're in the hospital. So that's a pretty helpful piece of legislation. It's got to be kind of filtered down from the federal level through the state level, through the state Medicaid programs. So that's something else we're kind of keeping our eye on to see how that might get implemented, if it's able to be implemented quickly or not. Just wanted to kind of put that out there from the CARES Act perspective, that may be related to this question, as well as, you know, the availability of supports for our folks with DD who are in hospital.
Excellent. Thank you, Michael. What I'll do is I'll move us to the next slide, which is really just a placeholder so we can get the captions on the screen. And we'll look at some of the questions that you had, both that were emailed and were dropped in the chat window already. And Deborah, I know you wanted to take on one of the questions that was sent in from Linda, which was what happened?
There were a couple of questions that were raised about individuals with disabilities and the challenge of individuals wearing masks, about individuals not wanting to wear masks, being uncomfortable, and for people on the spectrum, a lot of the sensory issues in terms of the nature of masks. So the Boggs Center is part of a national network of university centers in disabilities, and also Leadership Education and Neurodevelopmental Disabilities Program, which focus on autism. So we're putting out a call to our colleagues around the country to see what innovations people have developed. And we're also going to try to galvanize some of our students and staff that have behavioral expertise to see if we can create a bank of resources, of suggestions, tips, desensitization strategies that families or DSPs could use to help people both understand the use of masks and help people tolerate the discomfort. So we will add that information to the Boggs Center website, along with our other COVID resources. We're also including, which is slightly beyond that question, we've also just included a lot of resources on grief and loss for people with disabilities, because this is a time of great loss for people, the loss of routine, familiar faces, activity, and of course, significantly loved ones. So those are available to people also through the Boggs Center. And I think we'll flash the addresses on at the end. Thanks for the opportunity to address this and for raising these issues about masks to help people stay safe.
Excellent. Thank you, Deborah. And just another housekeeping thing, I just keep thinking of them as we move through. What we'll do after the session today, when the recording is placed up online, we'll make sure for everybody who registered for the webinar, which you did obviously if you're here, we will send you a link to the recording online and also a link to these slides, because I know the slides have some information in them as well that would be important, some websites and the contact information. So we'll make sure we get all of that to you as well. Any of the other panel members want to jump on one of the questions that was asked? Let me see. Does anyone know of a plan for reopening day programs and residential placements?
This is John Seafried. I can attempt to answer that. The answer is that we don't know when at this point the facilities will reopen. It's going to depend on a lot of different dynamics. The governor, Office of Emergency Management, so on and so forth. And I think they're still developing exactly when things do reopen, the pace at which that will occur. Like, is it going to, just be one day everything's back and everybody's doing exactly what they did in congregating, or if it's going to be a phased-in kind of approach? I can tell you that for day programs, we would, be work through that slowly, you know, and intelligently, and make sure we're giving people notice for that. We recognize that people are going to have different levels of concern related to when things open back up, depending on the specific needs of an individual, like if somebody happens to have some more underlying health conditions and not. So, so I can't give you a firm date, and I can't say today exactly what it'll look like, because we just don't know what we're going to look like on the ground in, you know, 2-3 more weeks when things open back up.
Great, thank you. Let's see. Sorry, everyone, trying to manage looking through emails and through the chat at the same time. Day programs. Masks we spoke about.
Hi, Mike, it's Mercedes.
Hey, Mercedes.
If I just take a moment, one of the questions that was submitted in advance was raising the issue of having testing done earlier or, you know, as soon as possible for DSPs, rather than waiting for individuals to develop symptoms so that we can get ahead of the spread. And while we don't have an answer for that, I just want to say that all of our DD Act partners on this call and I know DDD is equally as concerned about getting ahead of the spread, and testing is, you know, one way to certainly do that. So our advocacy will continue in that regard, and we wish we had an answer today, but we will certainly be doing everything we can in the spirit of advocacy to see that through.
And this is John Seifert, just to, I guess, amplify and agree with Mercedes. We totally agree that wider scale testing and faster testing is needed, and testing in a way that can accommodate individuals with developmental disabilities, you know, to be able to tolerate a test. And it is something that we talk about daily and brainstorm and are looking to solution as much as, you know, as fast as we can for. As you guys, as everybody knows, COVID-19 is a national crisis, and you know, and New Jersey is, you know, obviously been hit very hard by it. So we continue to work with all of our partners. I know even whether it's the department or even the governor's office, everybody's trying best they can to get things pushed out as quickly as possible. And we are very thankful to whether it be the Ombudsman, New Jersey Council for Developmental Disabilities, Disability Rights, or the Boggs Center for helping enforce that message as a community block, that this is something that we desperately need together. So thank you all for that.
Thank you. A couple questions in the chat box that have popped up. Are there guidelines for day programs' interactions with their clients while they're closed?
This is John Seifried. Well, the day programs are, you know, closed. We said there shouldn't be any, you know, congregate programming where people are, you know, from different homes or grouping together, because that's how things are spreading. We know when the day programs did close, those agencies that happen to operate residential settings worked to reallocate those staff that worked in the day program to the residential settings and repurposed in that way. We did, as of last week, did finally allow the provision of some of our services to be done remotely. So some of those closed day programs can now, through telephone or video conferencing mediums such as this, can provide some level of service remotely. But any kind of face-to-face service right now, because we know even especially for people that self-direct, even though we close day programs, there's still a need for people that self-direct to have staff to come in, and obviously people in congregate settings like group homes. For people that live at home, really that team, the family, the individual, the agency, the SD, they really have to have that conversation related to the importance of that service and determine whether or not, and they've already had those conversations, obviously. Unfortunately, we've been into this for about a month now. It's been about 4 weeks. So so people shouldn't be congregating. We do have a lot of guidance out on our website related to social distancing, staff screening, so on and so forth. But there shouldn't be any congregate programming going on at all right now, outside of, just people in a group home who naturally live together or a family unit. So thank you.
This is Deborah from the Boggs Center. I also wanted to make people aware of a new webinar series we've launched called Just in Time, to help people who are either involved in programming in a different space than they were previously working in for families. And these are trainings developed in response to COVID-19. Things like making it meaningful at home, maintaining connections, employment, and well-being while social distancing, self-care strategies for direct support professionals, supporting positive behavior and mental health, and also and for providers, using virtual technology and web-based courses for staff training. So it's our hope that some of these efforts and others that we hope you'll suggest to us help people manage within the limitations of the pandemic.
Thank you, Deborah. Couple questions. One, Deanne put in the chat talking about her son who is aging out of one program and looking to get into another. And the tours of all the centers have been canceled, and she's looking for a suggestion. And also, they're in between school and DDD. What care services is her son entitled to? They don't have a DSP yet hired.
This is John. You went a little fast there, so I may not have gotten everything. But the last part is, what services is a person entitled to? Anybody enrolled on the division offers 2 waiver programs that for individuals that live in the community, our community care program and our supports program. Each program has a list of services that are listed in that particular program program's policy and procedure manual. Those manuals can be found on our website. And the services are pretty similar. The community care program offers an additional service related to residential settings in terms of staffing. But the services are very similar. But anything in there is a service that can be provided. Now, some services you need a direct support professional, some not. There's goods and services, which are goods and services. And there's other things, environmental modifications, vehicle modifications, so on and so forth. So you should really work with your support coordinator. And if you haven't been assigned one, you can reach out we had a slide for our DDD fee-for-service help desk. You could send something there and we could look into it. But for people graduating into the system, we did start assigning support coordinators actually in March, because we saw this coming to get those assignments done. And we're still open. We're still doing people through intake, still taking graduates into the system. We're still assigning support coordinators. The main difference is all of the plan development is going to be done either telephonically or through video with that support coordinator. But the support coordinator can help walk you through what all the services are and help you develop your service plan.
So this is Gwen from DRNJ. I'd also want to emphasize that we're still open, and our intake can be accessed either through the telephone, leaving a message, and somebody will get back to you, or through our advocate at drnj.org. And if you're having problems around that transition, and even right now, if you just need to talk it through with someone, you might not necessarily have a legal problem, but these are very challenging times. Please do call in, and an intake will be taken and will be assigned to the community integration team, and they can help you work through those issues. And Michael or Jill, did you want to add anything to that?
Hey, this is Michael. I don't think I've got anything specific to add. I mean, obviously, John is the authority, the literal authority sometimes when it comes to some of these issues. But yeah, if there's specific problems that aren't getting resolved, if anyone's running into a roadblock of some kind, give us a call. through the intake line, and we can see if we can try to troubleshoot, or if there's something that requires a little bit more intense advocacy, we can always address those cases as they come in.
I have a question that came in through the email asking about residential providers. Are residential providers required to provide both staff and residents with masks? And if a residential staff member is exhibiting symptoms of the virus, are agencies allowed to give them time off without requiring that they be tested for COVID-19? It's a two-parter.
Okay, so this is John Seafried. The second part about allowed to put people off without having a test, I couldn't answer that. Yeah. Every agency that provides services has different policies related to time off, and I know that there's legislation, so on and so forth out, and there's for-profit agencies, not-for-profit agencies, so unfortunately I'm not in a position to just globally give an answer related to it because there's nuances I'm not aware of. In terms of personal protective equipment and isolation, so on and so forth, as early as March 9th, we started putting guidance out related to things and have every week put more information out related to it. But we have information on staff screening. So in terms of taking, asking questions of a staff as to whether they're symptomatic, taking the temperature of the staff before they start shift. There are, we sent out some guidance this past Thursday, related to personal protective equipment and masking in general. Masks do need to be worn to eliminate community spread. And as I said, the division did come into the Department of Human Services and Division of Developmental Disabilities came into a modest shipment of PPE and have started pushing that out to providers. The guidance on the website, and there is a lot of guidance on this. There's one on masking that's, I guess the date would have been whatever Thursday's date was, I think the 15th or 16th. But you could read that related to it, and it talks about cohorting of staff and clients as well. So we do have a lot of information out there on that.
Excellent, thank you.
Mike, this is Gwen. I see that there is somebody who must have jumped on the call after we started who's asking a question about hospital visitation policies and support persons accompanying individuals into hospitals. And I'll just say real quickly on that, there's been a lot of advocacy around that, and the Department of Health is responding, and Mercedes has already shared that we're hoping that a policy will be issued early this week. Is that accurate, Mercedes? Just making sure.
Yes, that's accurate.
Yeah, we don't know what the policy is going to say, obviously. If you look on Disability Rights New Jersey's new COVID website, drnj-covid.org, we have the letter that we sent to the commissioner. Our recommendations are based upon the policy for Rush Hospital in Chicago, with a little bit of modification with the New York policy. But there are some policies out there. I'm assuming that New Jersey's looking at those policies and adopting them for New Jersey. So with respect to, there's, I think, also a piece of that has to do with payment and double dipping. And Michael touched on the CARES Act, but exactly how people would do the billing for that, I can't speak to.
Is anyone familiar with any resources about speech therapists providing teletherapy to day program clients who are now staying at home?
This is John Seafried. There's two levels to that. First off, earlier this month, the governor and perhaps Gwen or the council knows more of the detail, but telehealth was approved for, for the health plans, the managed care organizations. And that's for rehabilitative, services, OT-PT speech, but also other levels of remote service to stop people from having to go to doctor's offices and such. In addition to that, last week, we did allow some of our services to go remote. We do offer OT, PT, and speech through us, through our waivers, our community care program, and our supports program. So those are available there. We have a document on our website that on the DHS COVID website that talks about the remote services and what they are and how to go about doing that. So they are able to be done remotely.
Excellent. Thank you.
Mike, if I could just jump in for a minute also. This is Mercedes from the Council on Developmental Disabilities. So the council, as I updated 2 weeks ago on our town hall, that we had issued a COVID-19 emergency funding application, and we've received over 600 applications in a very short time. The application period has closed, but I will say that a number of electronic devices have been approved through the process, and we hope that for individuals over 21 that access through their DDD services for therapies that have already been approved, or for telehealth through their Medicaid benefits, will give people that opportunity to actually partake in those services with some new equipment that will be coming their way.
Excellent. Thank you, Mercedes.
This is John Seifert. I do see there's a question related to group home and visits and whether there's any flexibility there. Questions like, could there be some kind of, I guess, social distancing visit? My recommendation would be to contact the agency which provides care to your loved one and have that discussion. I don't know every individual personally, so I don't know exactly what is positive and negative in that regard. If a person seeing their family member and not able to give them a hug, I'm talking about the client, could kind of lead to behaviors like I wouldn't know that, but I would have that conversation with the agency and see if something like that can be arranged. What we're looking for is the suspension of visitors just because of that spread of COVID-19, and we know that is very hard. Additionally, there's obviously the telephone, but if there's a capability for Skype, FaceTime, Zoom, like any of those kinds of things as well, those virtual things, I know just from my personal experience with, family members I can't see, that it is difficult, and telephonic and video is not the same. We're all just working together to go through. But I would have the conversation to see if something like that could be worked out. The agencies are also dealing, just as anybody with self-directed employees may be experiencing. It's hard to get staff in, to have staff available to be able to staff different things right now. So, but I would have a conversation with the agency.
And I saw Jen followed up with a question about day program therapists transitioning to teletherapy. And that's also been a conversation that's been deep in the special ed area too, about what does a therapy session look like? And it's a really great question. And I think a great place to start with that is that therapist having a conversation with the client and their team that supports them about what are the activities we want to address and which ones make sense to do remotely. Not all therapies will work remotely. So it is kind of an interesting one, but it's a great question because it's something we're dealing with on all fronts as well. Anybody else, something from the chat that you saw that jumped in? I'm going to do a little housekeeping and I'm going to ask nicely, which is probably going to make it worse, for the person that's annotating on this slide to please stop. But I know that's just going to make it worse. So.
Hey, Mike, this is Michael from DRNJ. I saw that there was somebody in the chat was asking, would we be able to address the children's system of care questions? I think that's well within the realm of our scope. We have that children under 21 who would be in the children's system of care. Just like with any other question, can't guarantee we'll know the answer, but it might give us an idea if there's an issue out there, something for us to do homework on or to come back around with information if we can get it, or maybe at the very least to point you in the right direction. So to that person, I would just tell them, yeah, please go ahead and ask a question in the chat if you've got something on the children's system of care.
Sure.
This is John Seifert. I see there was a question about whether or not I just figured out where the chat box was in a meaningful way, so now I can actually, kind of go through it. So I apologize for that delay. But there's a question related to, would it be possible to utilize vacant day program spaces as isolation space for staff and clients? And the answer to that is yes, and that's been happening. We have, through our Office of Licensing, at the Department of Human Services, agencies have reached out, and it's actually something that we put out in our guidance that early on, that agencies should research isolation space, either in the home or if they have a day program site. Now, in the home, there may be a staff office that could be converted, or another area of the house, and they could contact our Office of Licensing to make sure that that space could be used. But in terms of the day programs that are closed, we've done that numerous times. Agencies reached out. There is a process that's involved with that to make sure that there's going to be food, there's adequate bathroom, showering, privacy, so on and so forth. But there is an ability there to have that reviewed and get that approved to be space for isolation or otherwise, in case it's needed or if it is needed.
And I wanted to point to Timothy shared a link in the chat. I appreciate it. That's a great link to share. It kind of follows up on Jen's question about remote teletherapy, and it was some information from ASHA talking about speech therapists and how they can provide services.
I see there's a question about a more technical question related to billing of day services in a remote fashion. I did put in the chat box here somewhere the email address for our fee-for-service help desk. I would email there. I can tell you that we're not, just because they could probably answer a more technical question related to it. I can tell you we're not looking to make the billing process more cumbersome and time-consuming than it may already be. So the definition of the service is already, known through our manuals. So really, the difference is the provision is remote. So you make sure you're documenting that the service definition, whatever you were doing meets the definition, and then note that this was remote due to COVID, and move through that way. We're trying not to make it a totally different process with things. But again, every service is a little bit different. Some were group, some were one-to-one, and you may not be able to, obviously you can't, well, it may be difficult to do a group kind of a thing over a telephone because you need a conference call for that, but they will be able to help with more specific questions around that. So thank you. It's a good question.
Thank you.
I saw another question here. This is Gwen, which may also be a Jonathan question related to parents who provided care when the day programs closed, and they were told that they would be able to be paid retroactively. What happens if they didn't actually get hired by an agency until mid-April? Can there be retroactive payment?
We're looking for that. We did say that, you could do it now. So all of those are going to be very specific. There are elements related to it that are, probably be too long for for the amount of time we have left. But if the individual emails that fee-for-service help desk, actually you could talk to your support coordinator too, but I would email the fee-for-service help desk as well. We have a team that's working specifically on this because we recognized the retroactive nature of some of these adjustments. So if you email them, we could give you kind of the more personalized answer than a high-level one that may not exactly pertain. As you guys know, you've seen one situation, you've probably only seen the one situation, and everything's a little bit nuanced. And I just don't want to say go down this road as a definite when there may be a nuance where we have to do it a little bit differently. But please email the help desk and talk to your support coordinator. We will get to the bottom of it and honor what we said.
Just going through the chat, make sure we hit on everything. It looks like we went back to get the questions. So thank you to the panel members.
This is Deborah and I just want people to know that the New Jersey's Medical Assistance Advisory Committee is meeting this Wednesday, April 22nd, virtually. And there's the opportunity to attend virtually for the public, not ask questions in person, but to email questions that they have about Medicaid funding to the Division of Medical Assistance and Health Services. And if you just type in to Google NJD as in division, M as in medical, A as in assistance, H as in health services, DMAHS, you can submit questions about the Medicaid program that we will try to incorporate in the presentations.
Thank you, Deborah. Sam dropped a question in the chat. When will New Jersey act to test residents and DSPs at the centers?
This is John Seafried, and as soon as we have the capability to, we're not holding back, I promise, either from the community side or the developmental center side. If we can get the mass testing together, we are going to do it. And we are working with our partners over other divisions, departments, and I know that the other advocates on this line, DD Council, Boggs, DRNJ, Paul through the Ombudsman's office are all advocating for the same thing. Testing, stating the obvious, unfortunately, is a national issue and no doubt an issue in New Jersey. From the dashboard that the governor puts out daily, we're over 70,000 positive cases, and obviously we have more than 70,000. And a little bit more than that in terms of testing. So in terms of just global testing, just as a state, we obviously need more capacity in that regard. So as soon as we can, we will. There was another question that I probably can't answer extremely well, but are intermediate care facilities held to the same requirements as state-run developmental centers? So the developmental centers are run under an intermediate care facility program, but it's intermediate care facilities for individuals with developmental and intellectual disabilities. So I think it is a little nuanced compared to a nursing home intermediate care facility, but the core pieces, I believe, would be the same. There would probably be some nuances related to it. I don't have the nursing home regs in front of me to be able to say what's exactly different from them.
So Jonathan, following up on it, this is Gwen. So nursing homes in New Jersey, we don't have any intermediate care facility CMS status. They'd all would be at a nursing facility level of care. I have to agree with you, though. I don't know whether or not the CDC requirements are different for that than it would be for an ICF. I also wanted to address a question, if I can see it now. Oh, sorry, I'm having such computer problems. But somebody asked a question, Mike, maybe you can read it to refresh me. There was a question about the medical rationing of care and tiebreaker points for people who might be caregivers. Am I remembering that correctly?
Yes. Here you go. As there are many parents caregivers in this virtual town hall, I would like to ask my question. Would being a caregiver of an individual with IDD be considered an extra point on the tiebreaker?
So this is Gwen. I have read the policy several times and I don't recall that being a factor, but I will go reread it again and see if we can get an answer out to this group. The scoring, you actually, if I understand it correctly, you don't actually want points. You want points subtracted in tiebreaker situations because the lower your score leads to the access to the rationed services. So I will go back and take a look. Healthcare workers do get a priority in their score. So maybe that includes caregiver parents. I will take a closer look. I want to emphasize something though. This policy is a policy that only goes into effect if certain things are triggered. It's not in effect, to the best of my knowledge, at this point in time. I listened to the governor earlier today, about an hour or so ago. He talked about the figures that our physical distancing from one another does seem to be flattening the curve. This is just incredibly good news, though we have to keep at it. And the numbers that he gave for hospitalizations, people in ICU, and the number of people on respirators did not indicate that we were going to be right now at a point where we would trigger a rationing policy. So I'm putting together what's in the policy with the information the governor gave today. This is my opinion. It's not anything government has said, but I don't think we're at the point right now where the policies are going to be triggered, and that's good news. We don't want the policy to be triggered.
And this is Deborah. I really want to reinforce Gwen's point. Of course, we're always concerned that there not be discrimination against people with disabilities or their caregivers. But the allocation policy, the issue of a protocol about rationing health care resources is only in place if we reach more of an emergency situation than we are at present. And again, I think there's optimism to be gained from the governor's statement, but part of our communal responsibility is reinforcing that we need to keep all the precautions of social distancing, self-isolation, self-quarantine, monitoring for symptoms in place so that we never wind up in the position of the healthcare resources of the state being overwhelmed.
Thank you, Deborah. And,
Mike,
at the top of the hour, yeah, go ahead, Gwen.
Yeah, I see you have the final thoughts up slide. So I just wanted to say two things. One is, if you're able to, Mike, if you could go back to the slide that shows our new webpage, just because I couldn't see any of the slides at that point in time, and I'm still a little bit behind everybody else. That would be great, so that folks know they can go there to get information. We launched it yesterday afternoon. We know there are things that need to be worked through in it. This is one of those situations that we made a decision that the good is better than the perfect, getting you what information we can, but we hope to be adding a lot more information to that and resources this week. And the last thing that I'm going to say is just huge thank you to Jonathan for joining us today. I mean, the truth of the matter is you are the source of so much of the important information everybody was asking about today, and we just could not have, I think, been as responsive without you joining us. And so we're deeply appreciative for that.
And this is Judd, and I'm very appreciative as a department in the division to be included. I do want to say we do over at DDD, we do have a weekly webinar every Thursday at 10:30 a.m. To give an update on things. So there are opportunities out of the town halls, which we're happy to participate in when we can, to ask questions. We also have those two email addresses I had on the slides from earlier, the DDD Fee for Service Help Desk and the DDD COVID Help Desk, that you could send questions to at any point in time. We're open. If you call the main office or the 800 number, you will get somebody who will be able to help you with the problem. So please just reach out if there is something. We are open. We are here to move things forward. And I just want to thank everybody for their bravery and fortitude in this time.
Thank you, John. And Paul, you wanted to add something in a final thought?
Yeah, sure. I'll keep it quick. I just want, Mike, thank you for that. And I want to thank my panelists, including my colleague, John Seafried, for being on this call today. And, want to thank everybody, the individuals, family members, providers, everybody who's coming together for these kinds of conversations. None of us can overstate the importance of having conversations, dialogue like this. It's how, we inform, we use your comments and your questions to inform our thinking and our policy making. And that's true always, but that's true now more than ever, because as we all know, I mean, the situation we have with the coronavirus is new, it's hard, it's fast moving, and it's having a real-time impact on the lives of all of us, including our loved ones. And so not only this platform, but your emails every day, your phone calls, keep them coming. Keep your questions and the hard questions and the suggestions you have, because we all of us welcome that and benefit from it. And I just want to thank everybody again for participating.
Thank you, Paul. Appreciate it. So as we wrap up for today, if we didn't get to your question in the chat, if you put it in towards the end, don't worry, we will pull the questions out of the chat and use those to inform some of the Q&A things that we work up after the fact of the webinar. We will have an upcoming event. We just don't have anything planned yet. So keep watching, and we will, I'm sure, as the panel members will agree to some future event. The email address is always there, questions@drnj.org. We will gather those up to make sure that we have them for the next event. The recording for today will end up on the ATAC NJ YouTube channel. So if you go to YouTube, search ATAC, A-T-A-C, NJ, and it will end up there. We'll also send you a link to the recording probably on Monday. We'll send you a link to the recording and also a link to the slide deck so you can review the slides moving forward. And we thank you for your time today. We hope this was beneficial for you. Thank you to the panel members. As always, fantastic. And thanks for tolerating me as your facilitator. Everybody have a great weekend.